Oireachtas, I would like to thank everybody that works in the HSE and the great work that goes on in many hospitals and frontline nurses, doctors and surgeons and everybody else and secretary staff. But just as huge issues around the minister around the whole running of the HSE and the Department of Health, I too want to sympathise with the Carter family and the other 18 families, 17 families involved here. This is truly horrific by any standard. Horrific. It's a horror story. You'd imagine that you were in a third world country. But when I came here first in 2007, I think, and I didn't check the figures exactly, but it's around 8 or 9 or 10 billion a year. Now it's over 21 or 2. And we're facing a 1 billion overrun. So money has been gobbled up, wasted, abused, misused. It's shocking. And we still haven't any accountability here for what happened, what went wrong here. I'm not a wish hunt against this surgeon, but I mean, where are the oversights? Minister Harris, in your chair, said in 2017 that no child will wait for scoliosis operations more than 4 months. Today, there are 120 waiting over 12 months. So, Minister, do you ever check back on the statements that you send out and the message of hope you might give in those statements to the parents, first of all to the patients, but to the parents and their wider families? Do you ever examine that? Can you sleep at night wondering, like, it's not money is the problem with the Department of Health and HC. It couldn't be money. And then we look at the Children's Hospital. A gravy train, runaway gravy train for God knows whoever. And the fact those contracts were signed and what's going on there and the way it's left. The children of Ireland deserve more. We just came from a mental health briefing in the AV room, and like the CAM situation in South Tipperary is just appalling. So it just goes to show that children in our country and being they can't get driver's license, young people. They can't get any kind of facilities. But mental health above all else, they can't get them. And they haven't the resources. And we saw the childcare people today protesting outside. Why are our youngest and brightest future and our most vulnerable being blackguarded by this government and administration and by several administrations and by departments of health and successive ministers? And blackguarding is all I could call it. It seems that there's some kind of an uncaring attitude. And our constitution says we will cherish the children equally, and we all want to aspire to that. And anyone with children and grandchildren knows that. This is truly shocking, and no words can. No, I fail for words to the true horror of this.
Thank you. Now, our